So lip fillers are dermal fillers, which are made of a substance that's already in our lips and in our body. It's natural to our body. It's a natural sugar called hyaluronic acid. And hyaluronic acid acts as your body's natural moisturiser to help plump things out. But it's important to understand what lip fillers were initially intended for. It's for lip rejuvenation, because as we age, our lips start to thin, they start to have small lines, they get dehydrated, and it's about plumping them back up again in a very natural way, not making them an excessive of your face. Our lips start to thin usually in our early 30s, okay? So that's a good age to keep that youth back in them. By putting small amounts of derma fillers, we can just keep our lips youthful and plump to how they were, say 5 years ago. If you look at photos 5 years ago, that's what we can do. So we've started here that the patient's lips are nice and numb. So first of all, it's good to mention that there is different types of lip fillers on the market. But there's three main drug companies that make lip fillers, hyaluronic acid fillers, and if we didn't like them, you can dissolve them, which is good if there's ever a problem or anything, we can just dissolve the filler. These things aren't sold online, so if you're ever buying anything offline, which people do, more than likely it's going to be counterfeit and not a hyaluronic acid filler, so you could run into a lot of problems. So, okay, we're going to just start off with the bottom lip. And we notice here are some small fine lines here at the bottom lip, and what we're wanting to do is just to help plump them back up again and give a natural result though. So as I said, with gloves on, clean as possible, and just a small scratch, and we'll just inject. Okay, and that's number one. So you can see the filler there. The filler integrates lovely into your own tissues and just becomes part of your own lip. It'll attract lots of water and plump out. So even though we see this lovely natural result just now, that's not going to be our true result. Our true result will be in a couple of weeks. So as we see the filler just going underneath the skin there, what that'll do is find its own niche in your own tissues and attract lots of water, and it'll plump out, and your true result will be in a couple of weeks. You want a filler that moulds lovely into your own tissue, so when you speak, it's nice and natural and not lumpy and bumpy. So we're just going to do another small injection at the bottom here. And that's our bottom lip done there. So as we can see, it's a bit more fuller, a bit more healthier looking. Again, we've got lots of blood vessels that feed our lip, so it's always important to tell the client that they may have some bleeding or some bruising, and it's always important as well if you're going to have a wedding or a special occasion, that you maybe come in the week before and not get it done the night before for a treatment. Okay, so what we want to do now is we want to even the lip up. As you can see, the texture's slightly different. So what we want to do is we're going to put a small bit of filler into the body of the top lip, and that's going to help turn the lip out, give us some more pink, and just be more in harmony with each other. So it's always good to explain to your client what you're doing. So I'm just going to inject into this top here. So you can see the filler, just inject there. Just give it a wee massage, just to help it along the way. And your client doesn't have to massage it, but your initial massage is important. Now you can see how that's increased in size, but only slightly, as I said, just to give a more natural enhancement. As I said, lips thin as we age, so it's about restoring that. Lovely, yes. That's okay. Thank you very much.